transport mechanism. Introduction to renal transport mechanism. All right, so introduction to renal transport mechanism is just trying to talk about how things move in the nephron, okay, the basic unit of the kidneys, you know, how things move in and out. So for the renal transport mechanism, we said I just refers to the process by which kidneys move water, electrolytes, solutes across different areas of the kidney. Okay, so here you're basically talking about the nephron. You reduce it to talking about just a basic segment, you know. So nephron is actually the basic unit of the kidneys. So it's a functional unit of the kidney, alright. So it uses specialized transporters and channels to reabsorb essential substances and secrete waste. Okay. So what's the proximal tubule? Is a major reabsorption site. So reabsorb about 65 to 70% of everything that will be filtered. So transporters uses a sodium hydrogen exchanger, sodium glucose co-transporter, where glucose is reabsorbed with sodium. We have the carbonic anhydrase system that facilitate that what bicarbonate to be reabsorbed back into the body. Okay. Then, alright, clinical importance is, if you understand how the proximal convoluted tubule is functioning, of course, you understand how diuretics that act around that place should actually act. The next is the loop of Henle. That one is mainly absorption of water, not any solutes. Okay, just water. Okay, so also have transporters like the sodium calcium chloride transporter. Okay, that one helps in sodium reabsorption. All right, so clinical importance of here is, if you know how it works, you should understand how loop diuretics will work, drugs like furosemide, bumetanide, and the rest of it. The next we have the distal convoluted tubule. That one reabsorbs mainly sodium and chloride, has a sodium chloride co-transporter, also regulates calcium reabsorption via the calcium channels. If you understand the distal convoluted tubule, you definitely understand how drugs like the thiazide diuretics that work at the distal convoluted tubule, how they will function. The collecting duct is a final regulation for sodium, potassium, and water. Okay, so you have the epithelial sodium channels there, you have the aquaphorines. So drugs that work at the collecting ducts include the potassium sparing diuretics. Those ones, they will encourage that more water is being put out from the system, but potassium is being held back, you know. So that's it for the renal transport mechanism.